communication. You know, the government in the first wave had this thali bajao, diya jalao, all kinds of campaigns launched to build consciousness of the need for social distancing, for masking, for support for COVID warriors. Would you suggest course correction? Has the time come to focus less on event management, as some call it, and look at science and data much more seriously and then communicate?
Absolutely. What we have seen in country after country around the world is countries that have done a good job of managing the pandemic, countries that have done a good job of stopping large outbreaks. You've had very clear communication from political leaders. We need that starting from the prime minister all the way down to chief ministers, health ministers, others. Everybody needs to be talking about the science and evidence and what it is that India needs to do to get through this. The good news is that this pandemic will end. It will end when a large proportion of India is able to get vaccinated. Until then, we have to be very careful. Right now, we are in a crisis in India. It needs to be brought under control before things get much worse.
So would you say that, the crisis has in some way been mismanaged, or would you say that the government has done a reasonable job?
I would say there has not been enough communication from the government about the seriousness of where we are. There has not been enough focus on these rising cases until things got very bad. The policy response here is too slow, and the communication is ineffective. We need much more aggressive action from policymakers at the state and at the central level.
And even if, let's assume the cases taper down, you're saying there's no room for complacency. Are we looking at another 6 months to even a year where we will continue to get these waves? Is that the worry that most health experts have, that this is not going to stop in a hurry?
This is not going to stop in a hurry. This is going to take a while. But here's the key point. You don't need waves this size. If you act early when you start seeing waves, you can usually stop them with relatively mild measures. If you let it get out of control and take off, then yes, you have to get very aggressive. So the key point here is to be much more proactive. Get this wave under control, but then be proactive over the next 6 months while India gets vaccinated. India has a lot of vaccination capacity. It needs to vaccinate its population. And while it is doing that, yes, we will have to continue to be careful, not lockdowns, not anything quite like that, especially if we stay proactive.
Okay. Dr. Jha, as always, pleasure talking to you. Thank you.